This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2020. In 2016, the Centers for Medicare and Medicaid Services introduced a new bundled payment program for hip and knee replacement, or HKR procedures, in selected metropolitan statistical areas, or MSAs. Early studies revealed that, in addition to reducing costs and improving quality of care, the implementation of the program resulted in a trend towards the selection of healthier patients for HKR and the avoidance of patients who were more likely to have complications or require costlier procedures. To confirm the validity of this trend, researchers from the Johns Hopkins University, USA, investigated the characteristics of patients who underwent HKR before and after the implementation of the program. Patient characteristics were also compared between HKR and hemiarthroplasty, which was not part of a bundled payment program. Results showed that for HKR, there were no significant pre- or post-implementation differences in the proportion of patients with a higher risk of complications or remission, such as Black patients, those with lower income, and those with tobacco use, obesity, diabetes, or higher Charlson Comorbidity Index, CCI values. However, a small but significant difference was noted in the CCI values and diabetes incidence between patients who underwent hemiarthroplasty and those who underwent HKR in the selected MSAs after implementation. This difference indicated the possibility that some surgeons may have preferred hemiarthroplasty to HKR for less healthy patients after implementation of the program. Overall, these results reveal limited evidence of bias during patient selection in the bundled payment program for HKR.